everyone, I'm Dr. Angela Mattis, Consultant Ophthalmologist at AB Vision Eye Care, and welcome to Ask Me, our monthly sessions where I answer your pressing questions about eye care. Today's question says, Dr. Mattis, as I'm getting older, I want to improve the appearance of my eyelids and eyebrows. Advise me of the cosmetic procedures you provide. Now this question gives us a little information on the patient. The patient is older and the patient wants to improve appearance. Nothing was mentioned about having any visual impairment, but we'll discuss everything. As was mentioned before in a previous recording, oculoplastics, also known as oculofacial plastic surgery, is a type of surgery that focuses on structures around the eye. Oculoplastic procedures can be performed for functional or aesthetic or cosmetic reasons. The question of functional versus cosmetic surgery often arises. Here is a difference between the two. What does functional surgery mean? Now, functional oculoplastic surgery is considered medically necessary. It is designed to help with the function of the eyelid or the areas around the eye. Now, examples include ptosis or a droopy eyelid, eyelid malpositions when the eyelid is turned out or turned in, eyelid tumors or skin cancers, trauma, eyelid lacerations or fractures to the orbit, and tumors around the eye socket and inside the eye. Now, what does aesthetic or cosmetic surgery mean? Now, this is oculoplastic surgery that is not medically necessary. It is done to improve the appearance of the eyelids and the surrounding regions, the brow, the forehead, the cheeks, the face, etc. And some common aesthetic procedures include folds or sagging skin above the eyes, puffy under eye area, bags under the eye, a tired appearance, or eyebrow or forehead lift. Now let's look at these eyelid conditions and what can be done. Now, what causes excess upper eyelid skin, medically called dermatochalasis? As we age, our bodies produce less collagen and elastin, and these are proteins responsible for taut and youthful skin. The decreased levels of these proteins can lead to the development of loose, sagging skin on the upper eyelids. There's also a genetic predisposition, and that can lead to premature excess skin development to the upper eyelids. Now, what is blepharoplasty? Now, blepharoplasty is a surgical procedure that removes excess skin and fat from the upper eyelids to restore a more youthful and rested appearance. Now, how can you tell if you're a candidate for blepharoplasty? Now, one thing I must mention, if an underlying condition is contributing to your eye issue, your doctor will most likely treat that condition first before recommending that you have surgery to correct any lingering or drooping of the eyelid. If you're generally unhappy with your appearance of excess upper eyelid skin, puffy under eye, bags under the eyes, this can affect your self-esteem and confidence. And if you're in good health, blepharoplasty might be right for you. Now, what causes eyelid ptosis? Ptosis develops when the eyelid droops or falls to a lower than average position. Generally, aging is responsible for ptosis as the muscles stretch and weaken over time. In severe cases, ptosis can block or obstruct your vision and need to be corrected. So your eyelid is hanging at a much lower level and you're not able to see well. Certain types of ptosis are also related to neurological or muscular disorders. Ptosis can also be congenital, meaning that the child is born with the condition. What is ptosis repair surgery? Now, ptosis surgery corrects the drooping of the upper eyelid. This will lift the eyelid up into the desired position. Now, ptosis repair and blepharoplasty can be combined, and both can be done at the same time to improve both function and appearance of the eyelids. Patients with excess skin on their upper eyelids can, as I said before, undergo both procedures, and they can be done at the same time. Now, what are the alternatives to surgery? The question mentioned what non-surgical procedures also exist. Now, alternatives to eyelid surgery include non-surgical treatments like Botox, dermal fillers, laser resurfacing, and skin tightening devices. These methods can help improve the appearance of drooping eyelids, reduce wrinkles, and achieve a more youthful look without the need for surgery. Botulinum toxin injections, which we know as Botox, can help lift your brow without the surgical intervention. It will help to smooth the skin around the forehead and could give your eyes an elevated arch. The injection lasts between 3 and 4 months. Other non-surgical eyelid lifts can also be used to address asymmetrical eyes, and these non-surgical eye lifts can also enhance your appearance, and it eliminates the complications which may arise from surgery. Now, a non-surgical alternative doesn't take long. However, it is temporary. Non-surgical eyelid lifts can also be used to address asymmetrical eyes. A non-surgical eyelid lift can enhance your appearance without dealing with the many complications of surgery. The non-surgical alternative for lifting eyes doesn't take long and won't leave any mark or scars like surgeries, but it is temporary. There are eyelid tapes and creams that are promoted to work to give eyelids a more definition and reduce wrinkles. These, however, offer temporary solutions. They are non-invasive. Surgical procedures work for a better permanent result, but as I said, it is more invasive. So you will need to have a discussion with your eye care provider as to what is best for you. I'll also just use this opportunity to mention that although I have indicated that some of these procedures may be aesthetic or cosmetic, I will say that self-esteem is very important, and sometimes these procedures, although not functional, and by that I mean affecting your ability to see, a procedure which enhances your appearance really enhances your self-esteem, and you can go further. So thank you for watching. See you next month for our next insightful session, and remember, if you have questions, just drop them in the comment section below.